Hello everyone, I'm Dr. Sanaullah Khan, one of the resident surgeon and working over here, and my today's topic will be about history taking. This is a very basic topic, and I know everybody of you know something about the history taking, but to sum up all the histories of the medical education in just 2 mnemonics will be definitely a good thing to learn in this video, and I've tried my level best to make it simple and memorizable, which you can memorize easily. And okay, so before wasting my time and your time as well, let's start from the topic history taking. Before going towards anything further, I am going to request you to subscribe our channel Medical Online for future upcoming videos about medical topics and vlogs, and I will be sharing about diseases, different diseases and common or layman language. So that will be better if you will be subscribed and hit the bell icon as well. Okay, so let's start about history taking. First of all, before touching or when you come to in front of the patient, always remember you should introduce yourself. Never ever touch or never ever take any history from a patient before your introduction. It will be really your blunder if you're doing without any introduction. Like just in simple words, I'm Dr. Sanaullah Khan, and I'm one of the resident surgeon, and can I confirm your name and age please? I have written it over here, that introduction of yourself. So my introduction was in very simple 2 sentences. I am Dr. Sanaullah Khan and I'm the resident surgeon. Can I confirm your name and age please? Now this is just a bit of the introduction, just to confirm the patient that I'm taking the history of the right patient, right? So it will be, and again I'm telling you that can I confirm your name and age please? Okay, now after that, doing that, you will come towards the demographics, right? And the demography is like you will ask about, you already asked about the age, so you can ask about the occupation, what you are doing for your life. After that, you will go towards the presenting complaints, and everybody know that presenting complaints is the complaint which compel the patient to come to a hospital and to see the doctors. These are the presenting complaints. Patient may be having some body aches and some headache and some things like that, but that was actually the renal colic, for example, that bring the patient to the hospital. He will be telling you, yes doctor, I'm having flank pain, I'm having pain in the right flank and pain in the left flank, things like that. So that will be the presenting complaints, right? So now after doing these things, you will come towards the history of present illness. This is the thing where I have divided each and every history of the medical education in just 2. You will have to remember just 2 mnemonics, and after that you will be able to take history of any patient relevantly and correct history, right? Like just I'm telling you the first mnemonic I have written in the top. That is for each and everything of the medical education except pain, right? So here is the mnemonic. Write it with yourself. Only do clinical stations properly, relaxed and prepared. This is the one of the mnemonic, right? Only do clinical stations properly, relaxed and prepared. Right, now what does it mean? I have marked bold every first letter alphabet of the word, like only, it is only stand for onset. Onset, you know what does onset means? Onset of the symptoms, right? Like for example, if a patient is presented to you with which he is complaining of, the doctor, I'm having a lump in my neck. So how will you take the history? Just consider a lump as an example. I will be taking history as taking the lump as an example, right? So I will be asking that, yes, okay, I will ask about onset, right? How will I will be asking, did it apparent suddenly or gradually? So I am asking about onset, right? Now second word is only do, it's duration, right? D for duration. Duration, how long have you noticed the lump? How long have you noticed the lump? This is only for duration. Another one is clinical, C for course. Has it been getting bigger, smaller, and or remaining the same? So I'm asking about all the relevant questions about neck lump, right? First of all, I asked about onset. Did it appeared suddenly or gradually? Second, I asked about how long have you noticed the lump? Third, I'm asking about the course. Has it been getting bigger, smaller, or remaining the same, right? Coming towards the severity, station, just S for severity. Is the swelling present all the time, or does it goes and come again? How many lump have you noticed? You can ask about the severity as in this type like this as well. Okay, now coming towards the properly, P for precipitating factor. It's really easy. You can ask about, have you noticed anything that brings the lump on or increasing in size, right? I'm just asking about the precipitating factor. Now coming towards the relaxed, relieving factors. Have you noticed anything? Have you noticed anything that decrease the size of the lump? It's a relieving factor, right? Now coming towards the end, A for associative factor. So every history will be, the remaining history you will ask in associated factors. In associated factor, you can ask each and everything about, like you can ask about fever, you can ask about the pain, you can ask about the difficulty in swelling, you can ask about the difficulty in speaking, swallowing, each and everything associated factor you will ask about associated factor. Now the last one is the previous episode. Definitely you will have to ask about the previous episode. Is it the first time you have noticed the lump, or it was previously as well? All right, so this was all about the history of present illness of each and every case. You can take history just memorizing this simple mnemonic, right? Like each and everything, like for example, I'm just taking an example of bleeding PR. Definitely you will ask about onset, definitely you will ask about duration, you will ask about course, severity, and precipitating and relieving factor. So that's another case, and you can take history on the same with the same mnemonic, right? So history of present illness, you can ask each and everything. Now after completing your history of present illness, you will come towards the past medical and surgical history. Past medical and surgical history is very simple. You will ask, do you have any other medical condition? Have you had any operation or radiotherapy or chemotherapy, anything like that? So this is the medical and surgical history. After that, you will ask about medication and allergy. Important one. Do you take any regular medication? Do you have any allergy? Right? After that, you will ask about social history, which is also important. So you follow just this simple template, right? But the important thing was history of present illness, which I'm telling you the one mnemonic over here, and second mnemonic I'm just coming in a bit. So this is the template, right? After that, you will come toward the social history. Social, especially important one is smoking and drinking. Important one, all right? So after that, social history, taking social history, you will come towards the family history. And after family history, do you have any family history of any chronic disease? Like you can ask simple words. Okay, after that, I have written eyes. Important one. You will definitely ask about what does the patient think about the disease, right? Like for example, you will ask, what do you think it could be? What do you think it causes the lump? What do you think it causes the bleeding PR, right? And what is the most, second one is concerns. See first concerns. What do you think what are you the most concerned about, right? After that, expectation. What are you hoping us to do for you, right? Expectation. After that, you will come towards the review of non-relevant systems. You will ask about cardiovascular, you will ask about respiratory symptoms, you will ask about GIT symptoms, you will ask about genitourinary, neurological, each and every system in a brief words, right? After that, you will just come to the patient again. So, Mr. John, you have come here to me with a complaint of you are having lump in your neck, which is not increasing in size, and it's from the last 3 or 4 months, and it doesn't increase with anything, and it doesn't relieve with anything. Like, you will definitely summarize each and everything to the patient. After that, you will thank the patient, and definitely in summary you can told him that my differential diagnosis, one of the provisional diagnosis, could be due to it's due to thyroid or things like that. After that, you will thank the patient, right? So this was a brief about the history taking of all the history except pen. Now coming towards the pen. And a pen, it's everybody knows a simple and interesting one for simple mnemonic, which is Socrates. Everybody is using it. So Socrates stand for S for sight. You will ask about the sight of the pen. Onset again, character of the pen. Is it colicky or things like that? Does it radiate anywhere? Any associated factors, right? A for associated factors. Timing, you will ask definitely about timing, how much time from how much time you are feeling this pain, exacerbating and relieving factors, right? And then you will ask about the severity. So this was, if a patient is main complaint was, or chief complaint was pain, then definitely you will, in history of present illness, you will follow this mnemonic, right? And if the patient main concern or main complaint was something else beside pain, then definitely you will come towards this mnemonic, which I have already told you, which was only do clinical stations properly, relax and prepare. This is the general pattern everybody is using these days in exams, and even you can use it in your wards, in your general life. But in MRCS ASCII, it really helps, and it helps me personally very much, and that's why I'm telling you all these things. Okay, so this was about history taking. I will definitely discuss each and every history, and we will remember these two mnemonics, and I will discuss each and every history with you people in the other videos. This was just a general formula and mnemonics for you people. Okay, thanks for watching my video, and I will be again seeing you in the next video. And kindly subscribe our YouTube channel, as video people are really in great number on my Facebook page. It's almost 2.1 million, and I need your support over here for YouTube as well. So kindly subscribe and hit the bell icon. This is just for you people as well. It will help in somewhere in your life. And thanks again. Bye.